Well, hello everybody. Welcome back to Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, and next to me, the amazing and outstanding counterpart in naturopathic medicine, Dr. Jennifer Strong. So Jen is joining us tonight to talk about the impact of diet on how you absorb supplements and gut bacteria and microbiota and all a bunch of interesting topics like that. So I know recently I chatted with you all about the impact of supplements and in particular ALA. We have a great video up on YouTube now with a whole kind of PowerPoint presentation for it. So what I didn't realize is that just taking the vitamins and supplements is not enough, because taking them is important because you need to get those supplements into you, but how your body absorbs them is very much dependent on the gut and the bacteria in the gut, right?
Yeah, yeah.
So Jen's going to educate us about all that.
Yeah, great. Okay, so today we'll talk about digestion. So many times with patients we talk about the importance of the nutrients, and then we also need to address how those nutrients are going to get to where they need to go. So with protocols, often the dose is a little bit different for everyone based on what's going on with their diet, lifestyle, and their health needs. A lot of times in visits with patients, we talk about how stress impacts digestion, and we have a lot of aha moments when we realize how much stress impacts digestion. So we'll start from the top and we'll work our way down the digestive tract, and you can chip in whenever.
Yeah, sure. I had no idea stress affected digestion.
Yeah.
Tarek.
I can account for this.
Yeah, so let's talk about the parasympathetic mode and the sympathetic mode. So parasympathetic is when you're in rest and digest mode, so your body is quite relaxed. It's the opposite of the stress response. So when we're in rest and digest mode, all of our gastric juices are being produced, and with that we absorb our nutrients a whole lot better. So starting at the top, when we think about foods, we secrete more saliva. So just the idea of talking about food, like right now my mouth is salivating just talking about it. So the activity of talking about food or prepping food or thinking about food, we produce more saliva. Saliva has amylase in it, which helps break down starches. So for my patients who have a lot of difficulty with digesting carbs, like gluten in general, all the carbs. Oh, we need a mic. So with digesting carbs, we always talk about, think about your foods before you eat them, and that way it'll start digestion. Well,
Yep.
I think we're just gonna change some batteries for the mic.
It's all good. Keep going.
Keep going. Okay.
Yep.
Okay. So after we've thought about foods and our digestive juices are produced in saliva, our stomach's also triggered to produce hydrochloric acid. So with digestion, obviously we want some hydrochloric acid to break down our foods. So after we chew our foods at least 20 times per bite, that's the suggested amount to break down the foods properly, it enters our stomach, and that's where the stomach acids are ready to receive it. Stomach acids break down your protein. So for my patients who say, I'll take a protein shake and I'm always gassy after, then we have to talk about stomach acids and how well they're producing acids to break down the proteins. Stomach acid is HCl, so that HCl molecule binds with pepsin to break down the proteins as well in the stomach. And then
This is a terrifying review of medical stuff, by the way. But anyway,
but
keep
there's
going.
so much use for it. So the stomach breaks down all of your foods with the churning action, and then also with the enzymes and acids, and then it leaves your stomach and goes into small intestine, and that's where all the magic happens. So your foods are broken down. The bile mixes, the pancreatic enzymes mix, everything's broken down quite well, and then the nutrients go where they need to go.
Okay.
So let's talk about the sympathetic mode now, so the stress response.
Right.
So stress levels are high, or we're eating in a rush and we haven't thought about food, we just kind of grab it off the counter, chew it twice and swallow it. So in that case, stomach acid's not mixing, saliva is not mixing, foods are not broken down. They get into our small intestine and they're not able to be absorbed. And then they get into the large intestine, which is near the end of the track. It's a whole lot of work for the large intestine to break down the foods, and that's when we see a whole lot of gas, bloat, cramping happening, and then poor bowel movements. So that, in summary, is why it's important to chew your foods and to take the time to eat slowly, eat mindfully, think about food, chew it really well.
So what's the right number of times to chew your food?
I say 20.
20.
Yeah, so food goes in, chew 20 times. It does take quite a while. It's amazing though how different your food tastes from the first 2 bites to the last 2 bites. So I always say, like, think about your food and think about how it tastes and how the taste of it changes. You actually have to use your tongue to almost like keep it in your mouth for the first while, because we eat so quickly and so subconsciously that, you know, food goes in, you swallow it, and then it's like, oh, I didn't even chew my food.
So 20 times.
20 times. Yeah.
And then
Tarak should demo it.
we got lots of sushi left over, we probably could. So from the standpoint of the supplements, are there any that are more or less susceptible to the amount of digestion in your food? And do you have to eat, like, do you need to take the supplements with food to get them properly digested, or without food, or how does that all work?
Yeah, so general rule of thumb is vitamins with food, herbals without, because the stomach acids kill or decrease the efficacy of herbals. But vitamins and minerals with food, naturally they're found in foods. So we talk about food because mainly we want to get our nutrients from our foods. So we supplement when we're either not getting enough from foods, or when the need for them is more than what the food will provide.
Okay, so let's break it down for everybody, because I'm sure they're wondering. So vitamin D without?
With.
Vitamin D with food, okay?
Yeah, all vitamins and minerals with.
So your prenatal vitamin, just take it with food, basically. Yeah. Okay. And then if you're doing some of the common ones we use, so inositol, with or without?
With.
Okay. Even though it's not a vitamin, it's just a supplement. But
it's
not
a
an
nutrient.
herbal.
Right, yeah.
Okay.
It's not
all
a
right.
plant.
NAC?
With food, that's an amino acid.
Okay. Curcumin?
Yeah, that's a spice that's naturally with food.
So do that one with food too?
Oh yeah, because that one, it can cause like some stomach irritation on an empty
Yeah,
stomach.
on its own.
Mm-hmm.
CQ10, coenzyme Q10.
Yeah, that's naturally found in like proteins, like meats.
Okay, so again with food.
Yeah.
Okay. ALA, alpha lipoic acid,
Yeah.
the new one I started.
Yeah, with food.
With food
All
too.
food.
So all of these you should eat with your meals.
Yeah.
Okay, so which supplements are you commonly telling people to use that they don't need to take with food?
So like chaste tree. So for fertility, it's mainly like if we're not working with meds, sometimes we work with chaste tree, and that would be on its own. That's the only main one for fertility. Teas on their own, like dandelion, mint, ginger.
Do you tell people to use mint and ginger tea for their fertility? As an antioxidant? Is that the idea?
More for, because sometimes some of the meds can cause a lot of bloat, so the mint and the ginger is nice for it as like a carminative to help with the bloat. Mm-hmm.
Okay,
Yeah,
so just
like all
have
the
obviously the
progesterone
tea on its
doses.
own.
Yeah, kind of like sipping through the day. Mm-hmm.
Mint or ginger tea?
Yeah.
To reduce bloating.
Yeah,
Does that work for
lemon balm,
endometriosis
chamomile.
patients? Does it help reduce that kind of bloating?
You need more than mint.
You need more than mint, for sure.
Yeah.
Okay, so when I switch to endo patients, I'll frequently add in the curcumin, but for the PCOS patients, it's just the ones we talked about. So that's interesting. Okay, so how about if they're taking, for example, any particular type of diet? So if you have a more sugary diet or a more fatty diet, does that alter the absorption of those nutrients?
More sugary or more fatty diet?
Yeah. Like if I have a bacon cheeseburger, should I be holding off to have my supplements and have it with something healthier? And by the way, none of you should be having bacon cheeseburgers if you're trying to have a pregnancy, but yeah, what do you think?
Yeah, so I think you're gonna, like, if you commonly get digestive issues from those foods, then yeah, hold off and take it with foods that you digest better.
Okay. Cool.
But if you can down a burger without any digestive issues, I don't see how it would be a problem with the supplements.
That depends on how much of a rush Tarek and I are in before the show. So, what about antibiotics? What about the patients that, for example, have to take some for whatever reason? Whether, let's say they have a disruption in their, uterine microbiome, so we're giving them antibiotics. So what do we do with those ones?
You mean what nutrients they should take with it? Or?
Well, what should we do in terms of the nutrients or supplements we're giving them if it's around the time of antibiotic use? So should they hold off for a while? It's probably...
Oh, I see what you mean. So
they're probably not going to absorb as well,
probiotics and antibiotics are kind of like a dueling action. So
Sure.
usually antibiotics you take away from probiotics.
Yeah.
Which is sometimes tricky if you're antibiotics 3 times a day. So in that case, we just say hold off on the probiotics till you're done with the antibiotics. But if you can space it out a good 6 hours, then you can do probiotics and antibiotics separately. Otherwise, nutrient-wise, I think like dairy is an issue with the antibiotics. So we say take it away from like your cheese and yogurts and milk.
Do you recommend avoiding the dairy products for the supplements and nutrients as well, as a general rule, or just with the
iron,
antibiotics?
a few of them. So calcium and iron don't absorb well. That's why the PregVit has like the AM and the
Right.
PM. Yeah. So some minerals need to be separated, but those are the main ones. Iron's the main one that doesn't do well.
So iron and calcium, avoid taking with a dairy product, or around the time of an
iron
dairy product.
away from dairy. Yeah.
Okay.
Yeah.
That's interesting because milk and dairy has tons of calcium, but
No, just the iron. The iron away
just
from
the
dairy and
iron.
calcium.
Oh,
Yeah.
okay.
Yeah.
Okay, I gotcha. Oh, so the calcium interferes, you're saying, with the iron absorption. Ah,
Yeah.
I'm sorry. Okay, so it's not that the calcium absorption is altered by the dairy because it's
No,
chocolate
it's in
with
there.
dairy.
Yeah.
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 Okay,
So chocolate milk and steak, no good?
chocolate milk and steak are probably no good. Yeah.
There goes my entire...
Moses had it right about several
space
thousand
them out.
years ago.
You gotta
Yeah,
space
so,
them out.
yeah, no milk and meat together. That's probably why. Anything kind of on the horizon from the naturopathic end of things, or that's newer or we haven't discussed recently? I mean, I know you and I chat every once in a while, but anything new and exciting?
For fertility?
Yeah,
For fertility.
or non-fertility.
I don't think anything that new. We're going to talk about the estrogen relationship with the micro.
Yeah, sure. Go ahead. Chat about that.
Oh, okay.
Yeah.
Okay, so we worked our way down the digestive tract.
Yeah.
Now we're in the large intestine. The large intestine is well populated with gut bacteria.
Okay.
And the interesting thing about the gut bacteria is there's hundreds of different strains. And the diversity of the bacteria has an effect on hormones. So with fertility, we're always, concerned or watching how the estrogen levels are, and with either medications or how your body's naturally producing it. The interesting thing about gut bacteria is some bacteria produce an enzyme called beta-glucuronidase,
Yep.
which deconjugates estrogen. So your body produces estrogen, your liver metabolizes it, your gut bacteria makes it available. So
Okay.
when we talk about digestion and the importance of gut bacteria, it's important to recognize the diversity of the gut bacteria so that estrogen can be utilized appropriately.
So this is even if it's their own body's estrogen that's being produced, you're saying?
Yeah,
Interesting.
so some bacteria produce a lot of beta-glucuronidase. Some don't produce much at all. So when we think of, our endo patients where estrogen's a huge concern, it's important to keep their gut bacteria balanced so that they're not deconjugating too much estrogen.
So we've been using probiotics in our IVF cycles for quite some time now. And I do think it actually makes a huge difference. And I don't know if you were in the email or not, but we just got our results for the last several months since the start of the year. And we have had the highest success rates I've ever seen.
Wow.
So we're at 80% overall for our IVF program, which we are very proud of.
Nice.
So congrats to my
Yay.
team and the wonderful Dr. Strong who's helped us get there. And yeah, I mean, incredibly high success rates. And those are all, with rare exceptions, single embryo transfers. It's even higher if we have PGTA tested embryos. So we do give people antibiotics at the start, and then we give them the probiotics. I wonder almost if we should reconsider the antibiotics, because maybe we're just kind of messing things up, right? Because we are probably disrupting the gut microbiome during that process. Now most of this is for FET,
Right.
so less so for the IVF part of things. But I guess that then begs the question, during stimulation for IVF, should we be giving people probiotics? Because I haven't been doing that yet.
Yeah, so is it routine to always give antibiotics for that?
Not for stim,
Not for
only
stim.
for FET, for the frozen embryo transfer. But for the stim part, if you're saying it's really important to keep the gut bacteria uniform or balanced, should we be giving them probiotics while we are in the stim process?
Yeah, well,
I mean, it's harmless, so.
I don't think supplementing with the probiotics is like the only answer. Like it
Right.
might be more like those patients who have like IBS or like Crohn's colitis or some sort of digestive disruption. Maybe have like a conversation about that and see if it might be an option for those patients.
So then how do I keep the average patient's gut bacteria in check? Get them to see you?
Yeah. That's
So is that
usually the
mostly
conversation
dietary?
that goes on to figure it out, right?
Yeah.
Yeah.
Is that mostly like dietary changes for those people, or a combination of stress reduction and diet?
Yeah. So like there's a lot of factors that go into good digestion. Like stress is one of them for sure. Like diet's a huge part. Genetics play a huge role. Like if there's family history of digestive concerns. And then like bowel function, how well they're sleeping. Yeah. It might be helpful like for you to have like a little like maybe like 3 or 4 question thing to see if it's worth looking into.
Okay, cool. Yeah. You have to give me a little like
Okay, the 3
cheat sheet.
questions.
Yeah, give me a cheat sheet.
Okay.
Okay, so as long as I've got, do you have more to talk about on that topic?
No, those are the main ones.
Okay, so as long as I've got you here, I know that you've started doing IV supplement and vitamin therapy. So why don't you tell us a little bit about that?
Sure.
Yeah.
So that was a bit of a long process. So we set up the IV lounge to do IVIT, so intravenous vitamin therapy. So the idea behind that was for our patients, for men and women, who are wanting to get their nutrients up really, really quickly. Say they have like an IVF plan or an IUI plan and they've only got like a couple months to get the nutrients in check. IV therapy is a really quick way to do that because we don't have to worry about absorption of nutrients through the digestive tract. Just like we talked about, there's so many factors that are involved in that. With vitamin drips, it's a quick, it's a 1 hour, but it's a quick way to get the nutrients up. So when we do IVs of vitamins, it goes right into the veins. So it bypasses the digestive tract.
Right.
So all of those digestive concerns that we just talked about are not a concern anymore. It goes right into the veins, and then we get the levels up really quickly. So studies show that certain nutrients are important. So for sperm health, like the zinc and selenium are super important for sperm health. For egg quality and endometrial function, vitamin C is super important. So we've got a few different formulas tailored for that.
Yeah, and I kind of brought this up with Jen a while ago because there was a study I came across that suggested that the intrafollicular concentration of vitamin C was directly related to the live birth rate. And so I thought we had the equipment to test for it, and when I chatted with Jen about it, we just decided we would just start giving people IV vitamin therapy so that we could get their levels really high. So this is a fantastic option. especially if you've had struggles or it's been a harder time for you to get pregnant, this may be related to some of the features in terms of your overall well-being and supplement intake and exposures to antioxidants. So if you're chock full of antioxidants, then that'll really help you, because all of us have some degree of oxidative damage in our bodies. And now, actually, there was a conference I was at not too long ago where they actually showed that you can do reductive damage by overdoing it with the vitamins and the supplements. So we're just about to get a new device from a company called Myoxis, which will actually let us measure in sperm and in follicular fluid the amount of oxidative and reductive damage, so we can like actually custom tailor things for them. So even with your vitamin therapy, we'll be able to actually measure the impact on the sperm, which
That'll
is
be really
cool.
interesting.
Yeah, yeah, it'll be really neat.